This next session is thinking about human capital in a way that is traditionally not viewed as investment. So we're going to have a session later on education. Education, people think, oh, of course, we got bridges and we have education. Those are both human capital. This one is about, well, maybe some of the things that we think of as just spending to help people out. Maybe if they go to low-income families, they actually might have quite powerful effects on the future. And so that's what we're going to explore here. So this is thinking about transfers to low-income families and what impact might they have, and what does the research say about the impact that they have on future living standards, on growth, on productivity. So I'm going to invite Kristen Butcher to come up and review the evidence for us, and then Greg Duncan will come and respond, and then we'll have a discussion. Thank you so much.
Thank you. Hi, I'm Kristen Butcher, and I'm going to be talking about assessing the long-run benefits of transfers to low-income families. As we've just heard, we're used to thinking about government investments in infrastructure, maybe even in research, as something where there are upfront costs. There's a nice picture of the Big Dig from my neck of the woods in Boston. Looks costly. But then maybe having long-term benefits in terms of increasing productive capacity and helping workers to get to their jobs and goods to get to market. There's a picture of it looking a lot more productive capacity-like. But we're really not used to thinking about transfers to low-income families in that way. Mostly we think, I'm here to tell you, children are cute, and their suffering is acutely painful to watch, and so we think of the transfers as something that maybe ensures current consumption, makes sure it doesn't get too low, and makes sure that that suffering is not too acute. But could these be thought of as investments in human capital? Do transfers to low-income families actually change the productive capacities that the children in those families attain when they become adults? And in this way, are they then viewed, like those other investments, as something that has an upfront cost, but then maybe a long-term benefit, and perhaps even a benefit that is greater than those costs? So these are certain domains of investments that we might, or transfers that we might think about, and think about what's the scope for these to be actual investments. So cash obviously provides more resources, and maybe that helps buffer families from financial strain and all the related stresses there. Things like food and nutrition programs, the biggest one of which would be the SNAP program, the Supplemental Nutrition Assistance Program. Perhaps that ensures good nutrition at critical points in development, and of course it provides more resources more generally. And then we also might think about health insurance. That ensures or potentially ensures access to health care. And those things can either prevent or treat ailments as they arise. And of course, it provides more resources. And then finally, housing is the other domain that I'll talk about. That might ensure a safer environment, no lead paint, no asbestos in the walls, which we know can lead to long-term health consequences. And it might allow families to live in a better neighborhood. And of course, it provides more resources for the families. So there's a growing body of research that shows that there's a link between these early life environments and later outcomes. And so people tend to break this down into different periods. The in utero period, which is characterized by the fetal origins hypothesis that I'll talk about a little bit more. The neonatal period may be particularly critical for the development of some different types of capacities, or just a place where there might be sensitivities, and therefore those developments might be malleable, those capacities might be malleable at those points. And then early childhood and later childhood. And research has tied these things to different types of capacities that seem to be developed at each of these points. So the fundamental neurological architecture that we all carry around with us seems to be developed quite early. Things that are insults to the fetus quite early in development seem to show up fairly profoundly later in life. Cognitive skills have been shown to be malleable pretty early in childhood, and then non-cognitive skills seem to have some malleability even a bit later through adolescent development. I just pulled out a quote that illustrates the plasticity of human development. I must have been cold when I was doing this because it's all about sweat glands. And basically, this is from David Barker, who's the father of the fetal origins hypothesis, and it basically illustrates that we're all born with approximately the same number of sweat glands, and in that 0 to 3 age, if you're in a warm climate, you develop the capacity to use them more. If you're in a cold climate, you don't, and then ever after, if you go somewhere hotter, you're going to be better off because you can cool yourself down if you were raised in that hotter environment. So people think that there are many other capacities of human development that might be malleable in this way. And there's starting to be a very large body of literature that ties certain stimuli at different points in development to these later in life capacities. So there's a huge literature that's reviewed extremely well in that Almond and Curry piece about the fetal origins hypothesis. And it goes through different types of stimuli, nutritional insults that might happen, infectious disease, and maternal stress. And all of these, I don't have time to go into the details, although I love the details, but all of these are sort of mounted on a really rigorous platform of trying to find out when there's a group that is a treatment group and a control group. So you're not just saying, is it bad for your mom to be in an earthquake when she's pregnant with you? Like, I think we all think, yeah, I don't need to be that convinced, but then trying to find a group that is really, really similar that just has not undergone that same stimuli. And this body of research is large, growing, and very compelling that there is something that happens. There's evidence that even later in life, again, using these rigorous sort of platforms, that there's a connection between what happens early in life and later. And it is, of course, plausible that poverty can affect nutrition, disease, and stress in ways that could be deleterious in utero and in later time periods in childhood. But the big question, of course, is can transfers actually meaningfully alter these environments in a way that can affect these long-term capacities? And then the follow-on question of that is, of course, are those benefits that are going to accrue down the line greater than the cost in that upfront investment? So why might transfers not help these long-term prospects? Well, the transfers could, of course, just not be large enough to meaningfully affect the childhood environment. And parents might undo the transfer in some way. So they might reduce their labor supply. If you give somebody a $1, they might work $1 less. Then, of course, it depends entirely what they use that time doing. So if they use that time talking and reading to their children, then that might actually be a benefit. But if you look at the things in the short term, it's going to look like you didn't do very much because the total resources available to the household are going to be remaining relatively unchanged. I'm talking theoretically at the moment. There's a large and vast empirical literature that tries to look at all of these links. So, lots and lots and lots of research. Economists are obsessed with two questions. Are in-kind transfers the same as cash? That depends entirely on what the family would have done if they had cash. So if you give a child a vaccine, then if the family was going to give that child a vaccine anyway, you've just handed them the cost of that vaccine as cash, and it's all very fungible. If they wouldn't have done that, then you've fundamentally changed something. And then there's also correspondingly vast literature on what are the labor supply effects of these transfers. There's a quote in economics that's usually unattributed, and it says, how do you summarize economics? People respond to incentives, the rest is commentary. But then there's also a question of how much do they respond? And if you're interested, I will refer you to these volumes that I was going to, I think in the interest of time, I'll skip ahead. Here's just one example of why we might think that there are some big labor supply effects and other effects. So this is a picture across that horizontal axis. There's family income measured as a percent of the poverty line. And on the vertical axis is the share of children who are covered by health insurance. And the different colors correspond to different years. So the pink line at the bottom is 1987, and up at the top in teal, I believe that is, we've got 2012. And what we see is that with the expansions in Medicaid and the state children's health insurance program, we're doing away with that enormous dip that happened right around the poverty line in 1987. It doesn't take somebody who's like a incentives mastermind to think that maybe families who are approaching that cutoff point and were worried about being able to cover their children with health insurance might have had some labor supply effects. And indeed, the literature that exploits that variation across states and over time finds that low-income women are more likely to work when their children are not going to leave being insured as they do that. So the other snare potentially in the poverty trap is not only are these sort of concurrent offsetting effects, but maybe it's the case that low-income families, the parents build more capacity through working, you learn on the job, and if you're not working, then you're sort of capped in that way. And then potentially even worse, maybe there's an intergenerational transmission of welfare dependency. Right? We're starting to see some really interesting results coming out of the Scandinavian countries. All social scientists are pining for the fjords these days because those countries have this incredibly rich data that are linked across generations and across massive administrative data sets that really allow us to get into this. And there is some evidence that when the family of origin has access to, say, disability insurance, in this case, that the later generation is more likely to participate in that. And it's based on random assignment to judges who are adjudicating those cases. So it's pretty good evidence that it's actually causal. Now, what are the challenges to us understanding the long-term effects of the safety net that we have? There are two sources of those challenges. One is data, and one is that correlation is not causation, which I think is in my economist license that I have to mention that whenever I can. On the data front, if we want to see the long-term impacts across a range of these domains, well, we're going to have to wait until people are age 25 to look at completed education, something, completed fertility, age 35 to 40 perhaps, peak earnings, something in the 45 to 50 range. You get the idea. You're going to have to wait a long time to see whether these things manifest as having benefits across a wide range of domains. So if you just look at this brief start date of our big kinds of programs, only 2 of those are up there are older than I am. And so hopefully we'll have to look for a while to see the impact on mortality. And then the other issue is that even if we had a wonderful data set that connected what was happening to you when you were young to what your later in life outcomes are, we need to worry, why did you get that? It's not enough to say you got a transfer when you were young and now you're doing better or worse, because we don't know why the people got that transfer. And we really need to know, we need to have some way of saying, is this person doing better than they otherwise would have? And that's where we need the microeconomist toolkit, which really consists these days of randomized controlled trials. Flip a coin, you get it, you don't. Differences and differences, where we're leveraging the fact that a lot of times these policies get rolled out over different geographies over time, and we can say, hey, the people in this state can stand in for what would have happened to these people had they not gotten access to this program. And I won't talk about regression discontinuity design. Okay, in the 2 minutes and 4 seconds I have left, I'll talk about these very recent research papers that are going back to the dawn of our current social safety net and saying, what do we know about the impacts that these have had on the children at the time's long-term capacities? And interestingly, in the last year, there have been papers that have come out across all of these 4 different domains. All of these are based on a really rigorous research design where there's plausible treatment and control groups. So you can plausibly say that this is the effect of the program. So this paper by Azer et al. Reaches back to the Mother's Pension Program in 1911 to 1935. They look at people who applied for this program. So these are all people who declared themselves to be in need. These are people, the eligibility was basically you had to be low income and a widow or having been abandoned by your husband, and you had to have children. And then they look many years later at the people who received it and the people who were initially screened as being eligible, but then for some reason along the way, it was discovered they had more resources and so they were not eligible. And they make comparisons. And you can see that across a large number of domains, they find that these people who received this compared to close matches who did not are doing better in a lot of domains. Diane Schonsenbach's here in the audience. There's a lovely paper by her and Hilary Hoynes and Doug Almond that looks at the initial rollout of food stamps and SNAP. That was done county by county, and they can look at people who were in counties and got a higher fraction of their 0 to 5 years covered by food stamp accessibility. The program was available, and compare that to people who had less time covered. And they find that people who had more of that critical period in that 0 to 5 sensitive period in that 0 to 5 years had improved health in terms of metabolic syndrome and improved economic self-sufficiency. There are 2 new papers on health insurance, one of them leveraging those expansions that we saw the graph about in the 1980s and 90s, comparing across people who were in states that did and didn't expand, and they've linked that to IRS records. And they found that Medicaid eligibility for children, increased income and payroll taxes paid, decreased EITC receipt, reduced mortality by age 28, which is obviously not exactly when we think most people are going to be dying, but still it's noteworthy, and raised the likelihood of going to any college by age 22 for women. And they are able to do a cost-benefit analysis that suggests that the government's going to recoup about 56% of every dollar spent by the time these people reach 60. I'll skip over this one, but this is another one that looks at the very beginning of the Medicaid program in the 1960s, so we can see people who are a little bit older, and again, we see dramatic impacts, and there's evidence that there's a actual payoff to the government of a 2 to 7% return on investment. Okay. And finally, housing. There's one long-term study that's a follow-up to the Moving to Opportunity study. Moving to Opportunity study randomized people into 3 different groups: a control group that had business as usual, a group that had Section 8 vouchers and were allowed to take those to find their own housing, and a group that was told you can have a Section 8 voucher, but you have to move to a low-poverty neighborhood, and they had some counseling in order to do that. Following these folks up now, which some of them are in young adulthood, the researchers have found that the people who were under 13 when they were randomly assigned have quite striking beneficial outcomes. And interestingly, people who were over 13 do not seem to have these kinds of outcomes. Again, here we're able to do a cost-benefit analysis that if a child had 2 young children, the increases in the earnings and the taxes from those earnings are going to pay for the program in the long run. So, in conclusion, the research from this sort of dawn of the social safety net programs is just starting to come out. It's using really rigorous methods to try to distinguish between correlation and causation. And it really meshes quite nicely with this other literature that's growing about why the early childhood period might in fact be so sensitive and so important to invest in. And we are not always able to say in a really tightly specified cost-benefit analysis, are the benefits greater than the costs? Sometimes the best we can do is just ask the question, if the person got this, are they doing better? And so we're a long way from really understanding kind of a dose response and being able to rank all of these in terms of what is exactly the most productive. But those things that indeed are able to do a cost-benefit analysis seem to show pretty striking returns. Of course, this is always open to the critique. That was then, this is now. Would we get the same benefits if we increased investments in that way? And I will just leave you with saying that in my neighborhood in Newton, Massachusetts, there's no evidence that parents think for their own children that we're at the flat of the curve in terms of investing in childhood. All right, thank you.
It just showed up on the screen. There we go. I'm Greg Duncan from the University of California, Irvine. I'm visiting this year at the Russell Sage Foundation in New York City. And it's a pleasure to be here. I don't have big league comments about the paper, just some suggestions. So let me get started. The paper makes this point, and Kristen did too. When we think about transfers, we're obsessed with labor supply, right? This is not about labor supply. Labor supply is really a second-order concern in this paper. It is about to what extent the transfers have impacts years and even decades ahead on the children growing up in the families that are receiving the transfers. And Kristen highlighted the growing evidence from neurobiology about the importance of early life experiences in utero as well as the first few years of life. Paper finds in the empirical studies long-lasting impacts of a growing number of these different programs. And to paraphrase, studies of the long-term effects of cash transfers, food stamps, and so forth show remarkably consistent evidence of improved long-term health and attainment. So my comments are as following. I want to say it looks like there's something here. It looks like the timing of when the transfer is first received appears to matter a lot, with earlier being better. If timing matters, then there are some tricky policy implications, and I want to talk about those. And then finally, I'm not quite as sold as Kristen is about the robustness of the literature, but we'll talk about that. So, first 2 points. Looks like something's there, and what's there seems to indicate that when the transfer is received appears to matter a lot. She talked about the paper by Hilary Hoynes and Diane Schanzenbach and Doug Allman. Map of the United States. This is my candidate best map ever of the United States. It's not red and green. It's not red and blue, it's green. And it is this paper that tries to take advantage of the way in which the food stamp program rolled out in the 1960s and 1970s. All right, usually when a program rolls out, it comes at the same time nationally, or at least it comes in an entire state. In the case of food stamps, it was county specific, right? So the dark green shows counties that adopted food stamps later in this 20-year period, the lighter green earlier. And you see a lot of states, especially in the South, Appalachia, where counties behave very differently within the same state, right? So you could literally have kids born on the same day, living in the same state, a few miles apart, where one was in a county that had food stamps well before the baby was conceived, and another might be in a neighboring county where food stamps didn't begin until the child was age 3 or age 5 or age 7, right? So we're able to take advantage of the timing of when that food stamp was rolled out with respect to the birth date and then look 20, 30, 40 years later to try to see whether the timing of that rollout seemed to correlate with health and economic self-sufficiency. So this paper enables you to track year by year according to the time when food stamps are introduced into the county. So this is oriented toward exactly that. On the left-hand side, you have kids who were conceived in counties where food stamps was already there, and then as you move to the right, food stamps began later and later with respect to the birth year. So just to set things, this is an index of metabolic syndrome. It's bad to have metabolic syndrome. It's very predictive of cardiovascular problems. So higher scores are bad, and this is just taking the kids who were early middle childhood to almost to adolescence as the comparison group, right? So let's consider their scores to be 0, the reference group, and we want to see to what extent you had metabolic syndrome rates that were either higher or lower relative to this group of kids who were in counties where food stamps were introduced in middle childhood. This is a standardized scale, so the minus 0.5 at the beginning is half a standard deviation lower on this metabolic syndrome, and so forth. So what does the line look like? All right, it's a very dramatic graded relationship between the age at which food stamps was received relative to a birth year. So way off to the left, kids who were in counties that already had food stamps years before they were conceived, had 0.4 standard deviations lower levels of metabolic syndrome 30 years later, and then as you get closer and closer to the birth year, that starts to increase, and then in early childhood, it increases more. So the later the introduction of the food stamps, the worse off the child was 40 years later in terms of health, the worse off the child was in terms of economic self-sufficiency, which was the other thing that was looked at, right? So this is pretty dramatic evidence about the potential importance of transfers early in life. And it's really mirrored by a number of other studies that Kristen reviews, where the evidence seems to point to benefits when the income was received relatively early in life compared with later in life. If you look back to the negative income tax experiments, there was evidence to that effect, where there were achievement effects, not universally across sites, but by and large, impacts of the negative income tax payments to kids tended to be larger the younger the children were. The welfare to work experiments in the 1990s, same thing. They tended to be positive impacts when the kids were just making the transition to school. There were even some negative impacts when welfare boosted work and family income when the kids were older. Same result with Chetty. Kristen talked about that. Positive impacts of having this opportunity to move with the Section 8 voucher when the kid was under 13, but if the child was older than 13, there were actually negative impacts. And then health insurance, the same thing. So there's a fairly consistent literature pointing to the importance of the timing of the transfer with respect to the child's age. Why should early receipt matter the most? Kristen talked about the really interesting biomedical evidence to that effect. But if you think about it, it's a much broader set of things as well. Early childhood, the family is all important. Schools haven't kicked in. Neighborhood effects haven't kicked in. Careers are in their youngest stages. Income, family income is the lowest. And finally, early on, parents are most overwhelmed and least mature, right? Least able to handle the burdens of parenting. So when there is this assistance early on in life, for a variety of reasons, you could imagine these impacts being larger. So if that's the case, then there are some policy conundrums, right? WIC is directed toward young kids, but by and large, we really don't differentiate our transfer programs according to the age of the children. If we really think that transfers benefit families with young kids more than they do older kids, maybe we should either add a supplement to the earned income tax credit in the case where families have young kids, or think about just taking the existing pot of money for the ITC and reallocating it so that families get larger benefits when they have young kids and relatively smaller benefits when they don't. And then Section 8, the evidence is for positive impacts when the kids are under 13 years old, but the coefficients are actually just as negative, right, as the positive coefficients were when the kids were older than 13, right? So do you set up a Section 8 housing voucher so that it only provides eligibility for families when they've got young kids? Some of the families with young kids have kids who are older than 13 too, right? So we really need to think about how policy needs to address this problem that there seem to be benefits more positive in early years. So, and then I also took issue a bit with the strength of Kristen's conclusion about the remarkably consistent evidence. If you just take Section 8, for example, Raj Chetty did find these uniformly positive results, but uniformly negative results for the kids who were older than 13. MTO was an experiment that involved families living just in public housing in very high poverty neighborhoods. It's not the universal Section 8 program at all. And indeed, there's another evaluation of the broader Section 8 program in Chicago, Brian Jacob, that doesn't find benefits a little bit at younger ages, but not very much, and nothing at older ages. So I'd be a little bit more circumspect in the scope of the conclusions. And then I've got some other comments that I'll provide to Kristen. So that's it. Thank you very much.
Thank you very much. I just wanted to tell everybody, so we actually had 2 papers written for this conference by Kristen and by Sarah Turner, and they are both available on our website if you want to get them, and they both have a really wonderful discussion of all the evidence and sources of many studies, so if you want to learn more, that's a great place to go. Thanks very much. So part of the reason we did this conference is just, it seems to be sort of, I'm not an expert in this field at all, but just casually that the evidence is just getting more and more compelling that a lot of these programs really, do have a long-term effects, and that we should think of them as having a large investment component. Is that basically right? Are we there yet?
I think my takeaway is that I would still stand by the idea that there's remarkable consistency with the neurobiological evidence of these early interventions, and across these things that are evaluating the rollout of the dawn of the safety net, that there are these long-term impacts. And so I do think that evidence is quite significant and quite consistent. I will just answer your question about the Jacobs et al. Paper. The MTO is really important, and it's not just about housing. It's about changing people's neighborhoods. And so it's probably closer to basic science than it is this is how you roll out a policy, because as you said, what do you do with families who have a 13-year-old and a 2-year-old, right? That's hard for policymakers. But I think it does tell us the environment changes a lot, and the evidence from the Jacobs et al. Paper is that people didn't change their environment. And that might be because it's quite hard to find a place to live in a very different neighborhood. And so I think as policymakers and thinking about policies, you do want to think about what would families do if you just gave them cash, and then if you want to change their behavior even more, you have to think about what are the places where they wouldn't be able to do the same thing with cash. So health insurance, hard to buy health insurance on the private market. If you give people health insurance, you're probably doing something other than just giving them cash. Teaching people about the importance of the environment and how you move to a different environment or how you improve the environment, that's probably going to give you something different from cash. That part's speculative. But.
Yeah, well, I'm a believer. To the extent that I've invested the last 4 years of my life in trying to set up RCT that would, okay, I'll talk louder. Trying to set up an experiment that would enroll poor mothers who had just given birth into 2 groups, either getting $4,000 a year for 3 years or not, and then it's a collaboration with neuroscientists to try to see to what extent kids' brains are getting wired up differently as a result of cash transfers. We can also add to the list that Kristen talked about. We spend $100 billion a year almost on a child allowance, right? It's embedded in our tax system as child exemption, right? The child tax credit, the additional child tax credit. You add it up, and it's $96 billion a year. Right? It's paid annually instead of monthly. It's paid in recognition of the fact that families with kids have greater needs for income. And yet families who have no taxable income get nothing. Right? So if you really think about a more reasonable approach, it would be more along the lines of a universal child allowance, where you don't condition it on taxable income. And we're hoping that our RCT will be funded. If people have ideas for the final $4 million, we'd appreciate that. But I do think the strength of the evidence that Kristen reviews is such that the weight of the evidence is probably in favor of thinking that these cash transfer programs do have a component that's benefiting kids perhaps in the long term.
So let's think about going beyond some of these cash programs and think about like universal basic income or something. So you think about those, and a lot of people say that's a real waste because you're going to be giving money to everybody with kids or every family to make sure there's some minimum, and a lot of people don't need it. But then you do have, you don't have to worry so much about any labor supply effects. So when you look at the research that you're doing, it seems like it was mostly the income that mattered. How do we think about whether or not the programs would be even more effective if we didn't worry about labor supply disincentives?
Yep, that's a good question. I think that mostly the labor supply disincentives are something that we should worry about that much when we're looking at these programs for low-income children.
We should or we shouldn't?
We should not. I think we should try to make sure that they have the basic things that they need and be willing to say sometimes there are labor supply effects. But the evidence does not suggest that those labor supply effects offset the investments that we're trying to make.
Well, yeah, and we need to worry about the cumulative effect of marginal tax rates growing higher and higher. On average, marginal tax rates are about 33 cents on the dollar, I think, for the transfer programs that we have out there. So there can be disincentives, and we want to make sure that when we do put in place a whole set of programs that they don't end up with very high marginal tax rates and very substantial labor market disincentives.
So do you think that there's huge political emphasis on work, right? We're always thinking about getting people to work as being sort of primary. Do you think that there's just too much emphasis? I mean, it used to be, as you pointed out, that the idea of giving these subsidies to mothers was so they didn't have to work and actually could stay home with their kids. So do you think like that the politics have sort of gotten it wrong? And is it ever wrong because they don't think about the importance of these early years? Is that something that's made its way into the sort of public consciousness, or do you think not yet?
Well, I think that there are different people who are going to react in different ways. Some people are quite capable of going off and getting a job, but mostly we see from what we've seen from welfare reform that children don't do better if the parents just get a job and that total resources stay exactly the same. There needs to be some supplementation there. Again, what are the long-term consequences of that? Do families really learn on the job and have their wages grow over time? I don't think we know the answer to that, but I'm somewhat suspicious.
Yeah, it's such a difficult thing to orient a political discussion away from labor supply toward anything else. Throughout the welfare reform debates of the 1990s, I was trying with a bunch of other people to provide research and arguments about consequences for kids, right? And back in the welfare reform days, there were diametrically opposed predictions about what welfare reform would do for kids, right? There was Daniel Patrick Moynihan was saying, we're putting children to the sword, they'd be sleeping on grates. And then other people would say, well, the parents are working, it's going to be a positive kind of role model, it's going to be a good thing for kids. But despite those predictions, there was absolutely no content in the debate over welfare reform that was focused on kids at all. It was all focused on labor supply. If you think about a few years ago when we were debating cutting food stamps, I predict this time when we think about the safety net changes we're going to be making in light of the tax cuts, all the rhetoric is going to be around hammocks and lazy parents, and nothing's going to be about potential consequences for kids.
So I think what you're going to hear in that debate, too, is what you always hear is like the war on poverty has been a complete failure, right? That it hasn't gotten rid of poverty, that poverty is just as high as it ever was. So how do we take this evidence that, these things have long-run important effects and sort of counter that, boy, the war on poverty has been a failure?
I don't think that there's evidence that the war on poverty has been a failure. If you take into account what happens after you do the transfers, which I think is the point of the transfers, then poverty has fallen quite a lot. And so I think that would be a misreading of the evidence to say has been no effect on poverty. But I think that I'll just echo what Greg said. I anticipate the debate will all be about the labor supply effects. And I think my reading of the evidence would say it should be about what do children need at critical times of a development in order to fundamentally affect their capacities as adults? And I think we have evidence that we are running a great risk if we let them not have the things that they need as they develop.
During the welfare reform debate, there really wasn't that much evidence that could be debated, right, about impacts on kids. And I think what Kristen's paper shows is just the last 5 to 10 years, right? There's really been an explosion of very interesting, very careful studies evaluating the impact of these various programs that is really starting to put on the table pretty strong evidence with regard to the impacts on kids for later life outcomes. Now, we can choose to ignore that information, but at least it's there and it's much stronger than it used to be.
So I was going to ask you if you were going to increase spending, what might you choose? But I think also, let's think about the other way, which is what are the things we should be most worried about being cut going forward if we're going to be worried about the long-term impact on kids? Is there any way, so I know that the evidence isn't quite there to sort of say, well, the bang for the buck is biggest in Medicaid or in housing, or is there anything there to think about in terms of ranking?
Well, I would think health insurance. Health insurance is tricky because you don't expect immediate impacts on health, right? Health is a stock, not a flow, and you have to have something go wrong with you that health care could have either prevented or ameliorated before you're going to see the effects of health insurance. But these longer term studies do seem to show that expanding Medicaid, in fact, had a first order effect of allowing children to have more medical care and better coverage, and that these long-term impacts say that had a big impact on both their health and their productive capacity. So, and those are things that it's quite hard for families to buy on their own, even if you were to give them cash.
Okay.
Yeah, so there's health and there's everything else, and I think the everything else can kind of be lumped together in terms of what's happening to the aggregate resources that are being made available to low-income families.
So it doesn't matter
with
so
kids.
much. So we just want to care about the total. No.
Right.
Okay, we have time for a few audience questions from the audience. We have, can you bring the mics? Can you stand up and hit the gentleman in the purple tie? Say where you're from, please.
Paul Anirban, independent consultant. Question to Kristen and anybody else. Any specific reason you didn't include Head Start and a comparison of Head Start as a baseline with thought experiment if you had additional $10 billion?
Right. I guess the reason I didn't include it was because I thought that it had been really well covered in other places, and that these other programs had relatively less coverage.
Hi, George Friedlander. A suggestion that has a question, and I'll make it real quick. A lot of the work being done on technological change and its implications for the wage side as opposed to the labor side talks about income supports as a part of the solution. So that drags all of this into the more modern era, and I'd love to hear your response to that.
Kristen, why don't we take this question too, and then we'll.
I'm Diane Schanzenbach. Questions mostly for Greg Duncan. You seem to be more willing than I seem to be willing to redirect some of the current safety net investments from older children to younger children. So I want to ask you or push you to think a little bit about how we think about the short-term impacts versus the long-term impacts. I think that's based on long-term impacts, but I think there's some real important short-term impacts. For example, if a 15-year-old isn't getting enough to eat, he might do other things that are socially problematic in a way that a 2-year-old wouldn't. And so how do we think about those?
Take either of those questions, yeah.
Yeah, okay. Even for short-term impacts, especially achievement, school achievement, right, and to some extent social behavior, right? Right. The evidence is still fairly, in the way that we package assistance, right? Welfare, for example. We lump together cash programs with incentives that change labor supply, right? And one of the things that was discovered in the 1990s was when you both increase work and income, you had these positive impacts for the younger kids, right? And you had negative impacts for the older kids, in part because with the parents working, the kids were stuck, the teenage kids were stuck caring for their younger siblings, and that interfered with their schoolwork and so forth, right? And you've got with right, these dramatic differences between benefits depending on the age. So I'm not saying eliminate when you redistribute EITC, right? I'm not saying cut it out completely, but it seems to me the preponderance of the evidence suggests weighting it somewhat more toward paying with young kids makes sense.
I don't think we answered the question about changes in technology. I think that, we're in a brave new era where the robots may be coming for us all. And to the extent that it's harder for people to get a job in the low-wage labor market, I think these are going to be even more salient issues about how do we support.
The point is that you're concerned about the transition. Powerful case, this being even more important.
I think the measure of a good panel is it could go on forever. The problem we have is that this room is committed at the end of our program this afternoon, so we can't go over too long. So first of all, I want to thank Kristen and Greg for fitting more information into the time we allotted them than I thought was humanly possible. It's extremely efficient, and I appreciate that. So please join me in thanking them. All right, so we have a challenge. We have half an hour for lunch. There are sandwiches in the room on the other side of the aisle here, Sol Zilka, and paper plates and some sandwiches. There's some tables in there. You're free to take the sandwiches instead of the tables there. If you can find a seat, you're free to bring the sandwiches in here. There are drinks in the back of in the hallway out here. And so we're going to reconvene at 1:15. So please eat fast.